On top of this ruling on this New York law, we've also learned overnight and into today, getting new developments out of the Senate approving these new gun reform bills. One with school security upgrades in mind. It strengthens background checks. It closes the so-called boyfriend loophole, which makes sure that dating partners can't have guns if they do have a history of violence within a relationship. So we're seeing these gun reforms across the nation. Dr. Iroku, I want to talk to you specifically too about the work, as we're waiting for these viewer questions and comments to come in, about the work that Northwell, this Gun Violence Prevention Committee, is doing to protect people from gun violence. Talk to me about that work and about that committee.
So Michael Dowling, our CEO and president, late 2019 was very frustrated with what was going on in terms of gun violence. We had the mass shootings in Texas and Ohio, and he wanted to do something about it. He put out an op-ed in the New York Times to say that, yes, legislators have to do something in terms of the regulations, the laws and policies that we have, but that healthcare systems leaders should also do something. We can't be silent. We can't stay on the sidelines and just allow this to happen. We're the ones taking care of those who are injured, the survivors, as well as the communities that are affected by this. And so later he decided to create the Center for Gun Violence Prevention. And that was created a few months in the beginning of 2020, right before the pandemic. And the whole idea was to address gun safety. It's not about taking away guns. Gun safety, education of our healthcare professionals as well as the community, violence prevention, finding ways to intervene, collaborating with community-based organizations and others that are interested in this work, and then doing research. Research is very important to know what causes gun violence, what are the risk factors, and then pulling together all the stakeholders across the country, not just mainly healthcare professionals and systems, yes, but pulling in all the stakeholders to work together to figure out how can we address this problem.
Right.